The Duterte administration has left thousands of frontline workers unprotected and still refuses to strengthen the public health system. The inefficiency in taking measures resulted to alarming rates of infected healthcare personnel like nurses, doctors, technologists, nursing assistants, and barangay health workers. Our government cannot even go beyond providing personal protective equipment. We mainly lack PPEs and regular testing of healthcare frontline workers. And reports from the ground, like the health workers, tell of insufficient and delayed delivery of PPE sets and policies forcing them to recycle masks, coveralls, aprons, and other personal protective equipment, as well as they're being made to do overlong shifts. Women economic activities are mainly in the informal sector or the more insecure forms of work, which is characterized by lack of social protection and benefits, marked by a late start and snail-paced distribution 8 weeks after the lockdown. At least 4.1 million Filipinos have not received aid from the various social amelioration programs. The pitiful backlogs of the various aids are due to the delayed rollout, overly stringent qualifications, mechanisms, and standards. Slow distribution by the government agencies have been subject to complaints from the public and as well as the local government unit officials. Women OFWs or overseas Filipino workers outnumber men as professionals, clerks, service and sales workers, laborers, and unskilled workers. The Department of Labor and Employment has not extended aid to the staggering 76,684 migrant workers overseas. The DOLE has a 10,000 peso cash assistance program for OFWs, but it was inefficiently distributed. And to make things worse, OFWs were stranded due to the lack of proper mechanisms for transportation to their homes and provinces. Instead, they are locked and neglected in barely managed quarantine facilities. Many more OFWs are without aid, considering that the conservative target of 150,000 OFWs is far below the estimated 300 to 400,000 OFWs who would be laid off or suffer pay cuts due to the pandemic. In the Philippines, data shows that 602 people across the country were raped from March 17 to May 23 during the lockdown, or an average of 8 people a day have fallen victim to sexual assault during the community quarantine. Gabriela Party List Services team has been receiving numerous reports from the victims during the online legal clinics. Because of the pandemic, it has become even harder for women to come forward and access services. Most of the VAUC desks officers are essential workforce of barangays that they spearhead the other services like relief distribution. Second, there is the lingering doubt and fear that intervenes in asking for help because of the possibility of contracting the virus. And third, even the service providers for the victims find it hard to connect with them on ground because of the curfew. And fourth, private VAU service providers are not included in the list of authorized persons outside of residence that are given quarantine passes, which makes it almost impossible to rescue the victim. We urge this government to be proactive in providing measures, as there are none still, on the impending increase of domestic violence cases during the pandemic. Local government units are also encouraged to put up counseling centers aside from the currently existing women's desks to address the safety safety needs and continuously increasing concerns of domestic violence and assault survivors. In many households worldwide, women instantly assume the role of being primarily responsible for the care and nutrition of their families. Thus, they typically spend more time on productive work at home and fewer hours outside the house, while much of the overload of unpaid work is done entirely by choice. Constraints imposed by cultural and gender norms, labor market features, or lack of public services, infrastructure, and family-friendly policies take place. This work is essentially for the quality of life and of the family and their children. But the way it is shared between women and men is a major source of gender inequality. And as stated, it could be addressed by recognizing, reducing, and redistributing. Simply put, recognizing that the sharing of household work is very uneven towards spouses and puts women at a disadvantage is the first step. Second, reducing could mean hiring babysitters for childcare or reducing the burden from one of the spouses and sharing the responsibility to one another. And lastly, other household chores or responsibilities at home can be redistributed between the partners, taking paternity or maternity leaves even while working from home as one of the few ways practice redistribution to some extent.